It's a pleasure to be here. Anytime I have an opportunity to speak about Winback, or tech car in general, it's a great experience because it really has enhanced the way that we practice, and everything that Dr. Kim mentioned, with the patients just really resonating right from the beginning. For us has been really truly beautiful experience just to add on to whatever we're doing already. So I'm a big techie guy. I've always enjoyed working with technology, and a lot of what we do in our practice, in the physios we have on staff, we do utilize a lot of technology, typically stuff that you would be seeing, in a sports performance lab, or even like in a university lab, and we like to bring it to everyday practice. So for us, Winback, just makes sense. Being also a high tech, an innovative way of being able to do some manual therapy. But with that being said, my thoughts today was, to show you guys some cases where you could possibly apply it to, an array of cervical symptoms, cervical scenarios, cervical impairments, and not only apply it in a passive way, through our manual and our hands-on skills. I think we've all seen a lot of those videos, certainly in settings, but I also wanted to touch on the active components of it, which this is where a lot of what we do, really is highlighted. We really focus on dynamic, and bringing the patients from the table to out to the floor into the gym, and as quick as possible, have them regain function as quick as possible. So with that, being taken into consideration, I wanted to just make sure that I give you guys the ability to just see a little bit of what we do throughout different phases of healing. So I picked 3 different scenarios, and let me know if Dana, if it's all right if I start sharing the screen, or.
Sure, you should be ready to go.
All right, so let me get this going here.
Yeah, we can
see
that fine. Yep.
Perfect. Yeah, so I have this little slideshow set up on this side. I have my videos on the left side. I didn't want to really embed them into the video, into the PowerPoint here, so we wouldn't lose quality. But I handpicked 3 cases that I thought would be in different periods of time. So this first case that I wanted to talk to you guys about, we have here a 34-year-old female. She's a status post 3 months of being hit by a vehicle. She was actually a pedestrian, so took a pretty serious hit. Luckily, it was the car was slow moving, but nonetheless, she came to us not right away. She came to us actually a little bit down the line, 2 months after the accident. And you can imagine, by being hit by a car, you're going to get stiffness going in through your cervical spine, amongst other things. And the spasms actually had persistent all the way 3 months out. She would feel weakness, instability, a stiffness with her motion. So we've been working for about 2 weeks with her, 2 or 3 weeks with her, and I wanted to show you guys just where we got her at. I wanted to show you initially how we went about using some of the treatments here. So the first clip I'm going to show you, it really highlights just an example, right? It's an example of what you can do with a patient. We have other tools, right? So you can have tools like the one I'm about to show, like a Theragun, right? And you're looking to maybe decrease muscle tone. She was having spasms through her upper traps, levator scap, and I had the machine set up here to the RET plus and super beat setting, with the dynamic setting on. And so with this, for those of you who don't maybe aren't familiar with the dynamic setting, we have the ability to switch on and off between RET plus and RET. So you're able to go from more superficial soft tissue to deeper soft tissue. And so I'm giving a low, 20% level of current here, because the pad placement here, I've actually just placed a sticky pad right at the neck, cervical spine here. And then I have another sticky pad underneath her shirt, right at the thoracic spine. So they're relatively close to each other. The 20-30%, you can get some heat generating pretty quickly because they're close by. So just, nothing too fancy here, just doing a little low frequency percussion, trying to bring down some muscle tone in conjunction with an active motion there. And just very gentle, it's a very gentle treatment, trying to treat with a spasm. And so that's one example, as I was mentioning, of something you can include using something like a percussive instrument, but you have all different types of tools, I'm sure you guys know, that you can always overlay with. Now, because the main focus here with her is the instability at her spine, right? I did want to concentrate the current at her spine, so that's main reason why I had the sticky pad right at the cervical spine. So I'll give you another example here of just an active setting that I utilize with her. So right here, let's quickly just go back here. Using the RET dynamic setting, again, very similar setting to what I had before. I'm taking her through some pec release, and including some scapular re-education at the same moment. So my left hand over there is just providing some ischemic compression on the pec minor. You can get into the scapula down here, and work at the shoulder complex, trying to again release muscle tone from the upper trap, but at the same time getting benefits of the healing, passive circulation that's going through the cervical spine. So that's one of my favorite things about it too. There's certain structures in the cervical spine that we can't really, or we're going to have a really hard time stimulating, right, to promote healing. The passive structures, the ligaments, the interspinous ligaments, even maybe the discs, right? And so when we're thinking about the tendons, even of the muscles that were perhaps strained from the accident, these structures just receive that benefit, just by having the current running as you're running through any other manual technique. It could be, with any PNF or any other muscular re-education. So on to the next one here. Again, low level heat here. The idea is I have it at 10%. I also wrote down here on this side what I have. And while I'm having her do just an active contraction, trying to regain thoracic mobility, trying to encourage cervical stability, and again, getting the current running, same sticky pad location as what we had on the table, but now moving it in an active way, and keeping the low level current. Again, she could feel some of the warmth, and I'm okay with that. I'm okay with a little warmth. She's not somebody that's looking to go to perform necessarily, in a competition the same day or later on in that week. She's looking just to get better, to heal. So I am getting a little warmth as she's moving along here, trying to stimulate circulation and microcirculation, oxygenation in those areas that are difficult to get into. So we overlay it a lot with that, with activity. And this is just one example. It can be applied in many other examples. So that was my one initial case. The other ones are a little bit shorter, and maybe they kind of just build off of each other. So I'll try to move through these quickly here. But Dana, you let me know if how I'm doing on time too. Okay.
Okay, I will. We're doing good. Great information so far. So thanks.
Awesome. Yeah. So the next one, next patient, we have a 23-year-old female bodybuilder. So she was, I believe, 1 or 2 days acute. She strained her neck doing some some of her lifts. for her competition. She's in the middle of training, so it's very important to her to get back to training as soon as possible. The training schedule for a bodybuilder is just it's very tight, and so she needed to get back there as soon as possible. She presented with stiffness, spasms, referred pain to her thoracic spine and shoulder. And so, ultimately, we're looking at a facet joint dysfunction and acute neck pain here. So the goal with her was to essentially decrease the muscle tone, increase local circulation in the affected area of the neck, and decompress the facet joints. So again, I had really different settings on her. I'm going to show you just one of the settings that I had as an active way, and as another example of how we can address this scenario. So I believed I used 3 different applications on her. I didn't get all 3 of them on video, but we have here initially an RET setting, 20% low heat. And so we're looking just to bring some of the muscle tone down. The muscle spasm was actually preventing her from moving the neck into side bending or rotation comfortably and throughout the range of motion. So getting some blood flow with RET, targeting the soft tissue at the upper trap. I'm going to play it now here, so now you guys can take a look. I have a unique setup here. The sticky pad, I kept it here the whole treatment for the most part in the thoracic spine. This was my ground plate, and then I did a whole bunch of different things with either my CET when I was working on initially with my CET wands, all throughout the neck, the base of the neck into the suboccipitals, just wanding through for about trying to bring the muscle tone down for about 3 minutes or so. And then I switched over to the RET, and the RET current in a more active way. So here was a kind of like an in between me jumping in and doing some of the hands-on that you guys saw with the previous patient, where I'm doing some neuromuscular re-ed with the arm. So I'm getting the current running from the thoracic spine down into the right arm here. I did mention that she had some referred pain into the shoulder and into the dorsal scapular nerve. So I figured I would, want to open up circulation in those areas. At the same time, just throw in a little cupping, decompression, just in the open up some circulation in the superficial layers of the shoulder area. Certainly was beneficial too. Another setting that I used was the RET bracelets. This was my 3rd setting with her. I didn't get a video on this, but just to help do some traction on the neck. It was really nice for her just to feel warmth as she's also getting some traction at the neck, trying to decompress, again, just some of the spinal structures. And so with her, this is really what it was, as some active motion with the cupping as we have the current running, improving the overall health of that muscle there. And lastly, this was just an example. So here's another. I remember in this video, I didn't have an opportunity to use the tech card because I had my colleague waiting for. He was waiting 15 minutes for it already, and so I passed it on. But I would have certainly continued the same placement that I had with the RET pad at the arm and the thoracic spine. I keep doing this. I'm sorry. With this exercise here, just putting. We have an interesting device here that I don't know if you guys can notice, but there's some vibration going on with the resistance here, just to help facilitate low muscle, decreased muscle tone. But I would have certainly put kept the pad placements, ground plate here, RET here, get some circulation running while she's doing that at a low level of heat. And then the last one that we have here, case number 3. So just a whole different population, 77-year-old female, history of 5-segment lumbar fusion, and she was actually coming in. She slept at a hotel, like Dana and Donald are right now. She slept in a terrible bed, Then she woke up, had a, just acute or pretty much acute neck pain. When she came back to us about a week later, she was still having the neck pain, neck discomfort, again, limitation in range of motion. I'm thinking she probably had a sustained, long duration, low level load that pretty much just irritated her neck. So I'm kind of just, globally looking at a subacute neck strain. I'm sure there's some type of compression at a joint. It was hard to tell with some of the muscle spasms she was having. But you can also realize that this is a patient that we had originally been seeing for a few months back for the lumbar fusion, actually. And so, a little bit of a postural dysfunction. So looking here to, restore active range of motion and basically meet her where she is. She's 7 days, following her muscle strain and muscle spasms and the incident at the hotel. So we're trying to restore range of motion and also muscular effort with the upper extremities. So she was having a really hard time using her upper extremities because of the stiffness at the neck. So here, looking at, here go with my hands-on skills. I have the RET and RET plus dynamic. Here I'm trying to, with the dynamic, just have it span between RET and RET plus, switches back and forth. I have a high heat set on here, 60%, because I have both bracelets on my hand. So I want to get 30% of the current through my right hand and 30% through my left hand. It was, here just very gentle with the techniques here with my right hand, doing a bit of a strumming while she's doing some active mobilizations here. Also doing some soft tissue manipulation here on the right side. But so the reason I'm wearing the gloves, we found this out, Dennis found this out through one of the Winback experts. The gloves almost act like as a conductor, so it actually retains more heat at the hands. So you can actually, what I typically do, I'll do the gloves for a bit. It kind of acts like a CET almost, where you're able to retain the heat in your hands, and then I'll take my gloves off so we get more of the RET benefits. So that's the reason for me having the gloves on right there. Even just me holding my hand right there is going to give her some of that tissue warmth in the superficial layers. So just doing an active release. We'll move on to the next one. I have brought down the heat a bit. Same settings, RET dynamic, brought the heat down a little bit. I actually took one. I disconnected one of the ones off, or sorry, one of the bracelets off. Sorry. Disconnected one of the bracelets, and I'm working just with my left hand really, and I'm working into the suboccipital region. I'm working on my thumb in that suboccipital region, just trying to get a release in the suboccipital musculature, and at the same time having her do some isometrics as she comes back into the center right there, having her do a little hold and putting a hold against my resistance there, and making it a little active as well. And then finally here, just doing some, activity, trying to get her to the floor as quick as possible. I have a sticky pad at her thoracic spine with the ground current and a sticky pad here at her right side upper trap, levator scap area, having doing some thoracic extension holds. To her, this was going into extension. It kind of looks neutral to us, but because of her posture, given her posture, it was tough to perform. But anyways, low level current here, because we're going into activity. Activity is going to heat up the tissues much quicker, and so basically, because of the proximity of the ground plate and the ground sticky and the RET sticky, I want to keep the heat low, and again just promote some of the TechR benefits that way. So that is that's pretty much all I have for you guys here, and I'll stop share my screen here. so that's those are some examples. I try to give you guys different scenarios, different patient types. I think things that you could all apply, because at some point I think we're all working on either an upper trap or a levator scap or a referred pain or cervicogenic headaches. You're working into when you're looking at motor vehicle accidents and even concussions, and so they're just trying to hit the major points that with maybe perhaps something different than you've maybe used to. So that was that. Thank you for listening, everybody.